Good day, everyone. I am JP Maalihan, presenting Making TUPAD Happen, an impact evaluation of Tulong Panghanapbuhay sa Ating Disadvantaged Workers at the Rizal University Research Congress 2022. The Philippines, as an emerging economy, has always been striving for stability and sustainability, especially in the human capital and employment sector. However, the Philippines has always been a vulnerable country to both socioeconomic crisis and natural disasters, affecting the livelihoods of millions of Filipinos. In 2009, DOLE concluded that 4 out of every 10 workers in the Philippines were deemed vulnerable as supported by their statistical result regarding unemployment rate amounting to 42.6%. In light of the country's economic behavior towards the employment growth, they started to zeroing in on the provision of social protection and inequality and poverty reduction through Department of Labor and Employment. The government's initiative on alleviating the risks of these ramifications has resulted into commencing DOLE Integrated Livelihood and Emergency Program in 2009, or what we called DLIP, a program with the principal objective of livelihood restoration through immediate assistance to unemployed, underemployed, disadvantaged, and displaced workers. The strategy of DLIP is to protect and assist the vulnerable sector, and one of their strategies is to born its subsidiary program, which is TUPAD. TUPAD is a community-based program that provides assistance package for displaced workers, underemployed, and unemployed poor through Cash for Work scheme. They have also projects that includes social, economic, and agroforestry. In addition, DOLE provides TUPAD enrollees of the following benefits. Number 1, basic orientation regarding health and safety. Number 2, personal protective equipment. Number 3, microinsurance enrollment. And lastly, TUPAD ID. Beneficiaries would be paid 100% of the current minimum wage in the private sector. TESTA provides free accessibility to the agency's trainings in order to gear up the beneficiaries towards employment. But the question is, what are the effects of TUPAD on the vulnerable sectors? This study assesses the objectives of TUPAD by evaluating its impacts on total income of the beneficiaries using secondary data from the La Salle University Angelo King's Institute Community-Based Monitoring System or CBMS data from 2016 to 2017. The approach for this impact evaluation is the results chain. The results chain comprises of inputs, activities, outputs, outcomes, and final outcomes. The Philippine government has secured the resources of DLIP through state funding, facilities and supplies distribution, and staffing. Under inputs, there is a funding and staffing. For funding, the Philippine government has initially included the program's appropriation under Workers, Amelioration and Welfare Services, a subsection of Social Protection and Welfare of DOLE's Office of the Secretary. From its humble commencement to its notable recognition, the Philippine government has invested a total of 18.953 billion pesos of state funds. In support to the state funding, the staffing is categorized into two divisions, DOLE as the direct administrator and accredited co-partner as the local facilitator. The ACP or the accredited co-partner is comprised of people's organizations, workers' association, educational institutions, unions, federations, private foundations, local government units, cooperatives, and relevant national government agencies. Additionally, TESDA was staffed by DOLE in order to fulfill the objectives of TUPAD in skill enhancement. Under activities, number 1 is the qualifications and eligibility requirements. The participants are those who qualify and adhere to TUPAD's requirements, which are number 1, Workers in the informal sector, mainly the self-employed and unemployed. Number two, fit to work, non-pension senior citizens with 75 years of age as threshold. And three, beneficiary per household is limited to one member only. The projects under TUPAD are as follows: social and economic community projects, agroforestry community projects, LGU assistance, transport services, and sanitation of community. For its monitoring and evaluation, this is monitored by the Community-Based Employment Program online monitoring and reporting system, which the Bureau of Workers with Special Concerns supervises at regional level. Monitoring includes the updated list of the affected workers, approved beneficiaries, and issues encountered during the program implementation. Under outputs, number one is the cash for work based on the highest prevailing minimum wage in the region, social insurance amounting to 65,000 by GSIS, and the free TESDA training skills. Also, there is the personal protective equipment provision and the post-emergency employment assistance. The delivery frequency of the work spans from 10 to 90 days, depending on the nature of work of the project. Furthermore, the benefit delivery mechanism of TUPAD is through local money remittance service. For our outcomes, DOLE encouraged the TUPAD beneficiaries to engage in the projects, optimize its supplies, and access its related services. It requires its participants to complete the work period and fulfill the assigned responsibilities in order to enjoy the benefits. And as its result, the program expects to increase the household expenditures or its total income to increase through the increase of wages. For its final outcomes, in the long term, TUPAD expects unemployment rate reduction and improved living conditions in the Philippines. Moreover, the program anticipates development in the human capital and labor sector for the acceleration of economic growth. Ultimately, with the continued enhancement of the program, economic sustainability and sufficiency for the Philippines is envisioned. For the approach, this study utilizes a matching design, particularly propensity score matching, or what we call PSM, to determine the impact of TUPAD intervention to the income of the participants. Generally, PSM is a suitable method to compare the income of the TUPAD participants with their counterfactual group that did not avail the program. For this, the evaluation process design and determining the impacts of the PADs are as follows. Number one, identifying the source data, estimation procedure or empirical approach, defining the variables, and then running the program that would cater the PSM. The variables for this study is number one, avail TUPAD, which is dependent. Its measurement is 1 if yes for participants of TUPAD, 0 otherwise. And then age, years of employment, education, labor force, household size, which are all independent variables. For estimation procedure, we have used empirical approach and multivariate regression model. According to Heckman in his studies in 1997 and Smith and Todd in their studies in 2001, the participants and non-participants and TUPAD can be assessed through the empirical approach, which is shown in the equation of delta y equals y sub 1 minus y sub 0. For the propensity score matching, which is the main econometric method for this study, examines the above-mentioned change in the mean outcome, and this method has the prediction of the propensity scores, which is dependent on either Probit or Logit model. And in this study, we have used the multivariate regression model. For the results and discussions, we have observed of around 5,791 variables of those who availed and not availed TUPAD. Now, prior to the execution of the PSM is the regression analysis. With the regression, we have conducted the multivariate Probit regression. As we can see, age is significant, years of employment, education, so as labor force, and household size. This means that for every unit increase in the non-participation, they have increased also in the program participation. This is a very straightforward result. However, as you can see, for the years of employment, it depicts that for every unit increase in work experience, participation in TUPAD decreases by 0.010. This means that they have a statistically negative relationship. Now, succeeding the multivariate Probit regression, PSM was accomplished. In this method, total income of household is the outcome indicator. Moreover, there is a total of 126 in the treatment group and 5,564 in the controls group. The two groups were determined by the manual data analysis in which the common characteristics, poor and average annual income, were factored in. Poor is classified within the range of minimum wage earners to unemployed, while average annual income is based on the 2008 minimum wage, which is 475 pesos. Thus, accounting for the results of the prior regression analysis and incorporating the total income, ATP revealed that once a person participated in TUPAD program, their mean outcome in terms of total income is now 25,942.994. Correspondingly, with a T-stat value of 316, this means that there is an actual impact from TUPAD to the participant's income. Therefore, this denotes that availing TUPAD program can add up to 25,942,000 pesos to their average annual income of 140,254 pesos. Comprehensively, the mean outcome from the ATP can be divided into 30 to 60-day work programs set by the TUPAD administrators while accounting for the current minimum wage. To visualize the propensity score matching, here is our graph. Lastly, the sensitivity analysis was also conducted for PSM and it has resulted into a favorable outcome. Sensat of Stata, which is a platform for statistical tests, proved the robustness of the PSM through the t-value. The t-value must be greater than 2 to support the claims of robustness of the study. As depicted in the table, the t-value is 2.852 under 5,791 observations. Only EDUC in the variables was examined against EE-TUPAD and as Sensat can substantiate its results even when working only with one independent variable and one dependent variable. In conclusion, the PSM or our approach for this study as supported by sensitivity analysis is robust. Now, the nation's path, our conclusion and recommendations. The current situation is actually that our socio-economic crisis and natural disasters affect the vulnerable sector, thus leading to unemployment. The conclusion for this study is in a country where there is apparent vulnerability on socio-economic crisis and natural disasters, it is imperative to implement emergency employment programs to keep the economy afloat. This kind of program backs the interim financial needs of households while the job market is reviving. Correspondingly, this study evaluates the impact of TUPAD, an emergency employment program launched by the government with the goal of providing temporary jobs to the people who are displaced, disadvantaged, or work poor. TUPAD on the total income was analyzed through propensity score matching, which now resulted that they can actually add up to 25,924 pesos. TUPAD program significantly improves the living standards of a household through the additional interim income stream from the provided or available work set by the program administrators. However, it is important to acknowledge that education plays a vital role in somehow avoiding the effects brought about by any adverse circumstances. Had the government encouraged not just provide free education, the people finish their degrees through effective policy on education, displacements and disadvantages on work can be minimized. Consequently, the size of household may be a factor as to why one cannot fully fulfill its financial responsibilities. Economically, placing sex education and family planning into taboo still hinders the households to set their financial mindset on still hinders still hinders their financial mindset on checking first their capabilities and opportunities against the responsibilities before resulting into a large family. Once the above mentions were established, work experience shall follow, which can then later translate into a reduction of job displacements since there is enough years of service that can provide expertise. The recommendations is that zeroing in on the policies that reinforces the importance of education, family planning, better stable job opportunities. However, at the end of the day, indicators and interventions are just signposts of change. Again, let's work together to make improved living happen. Maraming salamat, De La Salle University.